North Dakota can apply for a Medicaid state plan amendment that would allow our state to serve several underserved populations. Many people are turning to emergency care and crisis units because they're the only places they can get help, or they're being evicted from apartments at a high cost to the state. There is a way to reduce costs and community burden like that, and more. 1915I is a Home and Community-Based Services Medicaid State Plan Amendment that has been available to states since 2005. 18 states use it for individuals with behavioral health conditions. It can expand coverage of services for Medicaid clients with behavioral health conditions and tenancy support services, which include services to help people stay well in their own homes and communities and help avoid costly crisis and emergency services. A 1915I could cover caregiver and medical services at supportive housing projects in Grand Forks, Fargo, and Bismarck, or provide these services to people in their homes, much like home health services. It could also cover behavioral health treatments, counseling, caregiver and medication monitoring, allowing people to receive treatment closer to home with no relocation or travel dates. Rural caregivers and providers can offer services in any location, and it can fully implement recovery reinvented and free through recovery. Communities and local providers can add services and bill Medicaid for services, which benefits the community, the client, and their families, reducing the burden on law enforcement, jails, and emergency services by placing care in the proper place. Adding this amendment could create new medical networks, as rural providers and others can add and expand behavioral health services. Services may help clients' housing needs, including securing housing, filling out applications properly, and communication with landlords, reducing evictions, terminations, and program suspensions. Legislators would vote to give authorization for North Dakota's Department of Human Services to apply for and fund a 1915I state plan amendment from the Federal Centers for Medicare and Medicaid Services. The application could include these target populations: people experiencing chronic homelessness, those with a serious mental illness or substance use disorder who are experiencing homelessness and or housing instability, and those transitioning from incarceration. It would establish the eligibility and define the home and community-based services, things like peer support, tenancy supports, case management, and supported employment. This will cost money to implement. The cost will vary depending on the number of services the state decides to add. The federal government would cover 50% or more of the costs of these new services under Medicaid. The good news is, money can be saved in a variety of other places, including shelters, law enforcement, emergency room visits, clinic visits, reduce the burden on state services, court costs, and institutionalization of clients. Why should North Dakota apply for 1915I? It would make our state services more efficient. Rather than continuing to push chronic care needs through high-cost emergency rooms, people can have care close to home or in their homes. This will take non-emergent needs out of emergency rooms and keep the cost of needed care at a lower cost level and a higher care level for individuals. 1915I would also allow agencies to communicate with each other in order to provide better client care, examine how organizations are serving clients, and provide better follow-ups. And it's the right thing to do. Let's use North Dakota's resources in a more efficient way. Let's meet people where their current needs are, rather than letting costs get out of control and leading people down a path where they will eventually need higher levels of care. Vote to approve the application process and funding for a 1915I state plan amendment.